They are the latest trends in teeth. New technology is making more cosmetic changes possible with our smiles faster.
And who wants to wait, right? Dental Laser is here to tell us all about them. Joining us again this morning is Dr. Thomas Sepik. Doctor, thanks for being back here.
Thank you very much.
Nice to see you. So let's talk about why Dental Laser and laser cosmetics decided to embrace this new dental practice.
You know, it's a paradigm shift. 15 years ago when I began there, we had 3 doctors. And we were thinking, boy, what's the future going to be like? And I said, big changes. And that paradigm shift means that we also began to embrace new technology, new ways of doing things. So that technique led us into today's teeth brightening. Heather's teeth are very pretty.
They're wonderful.
I don't mind saying it. You know, I would not have any opportunity to actually provide her with something new or a new smile because you can't really make it much better.
Oh, well, thank you. Well, everybody wants teeth whitening, though. I think everybody wants to have that bright smile, even if they think, oh, yeah, you know, you have really, nice white teeth. It always makes you look younger. So, and that's part of one of the examples we're talking about, right?
Exactly.
And this is faster. Can you talk about that?
Actually, we can use laser whitening, and it can be done in an hour.
Wow.
And laser whitening is with a laser machine and not something you put in your mouth. Now, you got to keep it up like all things, though, because the more tea and the more vino you consume, it tends to stain teeth.
So what's the difference that you see between like the trays and the laser?
The laser is something that is created just for speed and to change the way in which we do things so it's faster and better. So laser is much more thorough.
And whitening isn't the only example of this paradigm shift at Dental Laser. Talk about the other ones.
If you think about implants, we call them conical implants, porcelain veneers, laser whitening. Every time we do something, even like this slide now shows the actual mold that was made in something at the clinic. That's a brand new mold from a scan. That scan then will produce a product that actually is a set of teeth, completed set of teeth.
Wow.
And the only thing we do with those in the lab is just touch them up because everything is made by machine. It's the latest technology ever.
That's right.
And like the most precise, I would imagine.
Exactly.
So you have 20 oral physicians, and
Yes.
you call them physicians rather than dentists. And
Well,
there's a reason behind that?
Oral physicians are really the name of the way to change. And it has to do with the population that we're in right now. As much as I hate to say it, and include myself, older population of people have far more problems medically, and they're consuming medications at an increasingly, an alarming rate possibly. So we have to be not only capable or able to diagnose these conditions, but we're also going to be able to know what's going to happen if we find something, because oral infections in the mouth do unfortunately go straight to the heart.
Right.
So if that happens, then somebody's being treated for something that we can prevent, and that's the way the technology works.
Not only does your team, and we're seeing a picture here, they have your best interests at heart and in their mind. Talk about how the experience is other than that. How do they treat you when you go there?
That's a different question. Not that it's not a good question. Everybody accepts that our patients are really family. And frequently when people do come in, that's the first thing they say. And they're waving usually at most of the people who are at the clinic. They know the names of dental assistants, receptionists so well that I sometimes think, they must have been cued.
That's wonderful. That's how it should be, right? I mean, like we were saying, I think, another day this week, people sometimes fear going to the dentist.
Well, fear is promoted by uncertainty.
Right.
Yeah.
And uncertainty is something we create in our mind. It's just like all stress reduction techniques. If we can somehow say, hey, no big deal.
Well, especially because a lot of people who went like 15 or 20 years ago, they may have had a really bad experience and they haven't experienced it ever since, and everything is different now. I mean, you've come a very long way.
That's what a paradigm shift really is. Not only are we as providers changing, but so are the patients changing. They're coming far more capable and educated themselves to ask the right questions and want to see results.
Well, and that's the best type of medical relationship with a medical professional, right, is when you're well armed with the right questions. Because as a doctor, you don't know what you should help unless you get information from the patient.
That's it. And that's why I said the older population, in 2030, 20% of our population will be over 65. Today, it's 16%. So just imagine, in 20 more years, all the millennials will be in the 65 plus category. Not you, Matt, unfortunately, but that's the way it is. Some of us aren't so lucky.
Right. Well, you've given us a lot of reasons to go in and check out this new technology. Thanks so much, Doctor, for being here with us today.
Thank you.
And if you're interested in improving your smile, you can book an appointment with Dr. Thomas Sepik. To find out more information online, you can check them out at nogalesdentallaser.com.